Majority of the causes of blindness are either treatable by cost-effective measures or preventable. And if we target these 5 priority eye disorders, we can eradicate avoidable blindness in the world. In the Philippines, cataract, refractive error, and childhood blindness account for 75% of blindness. This was Tarlac in 2010. Eye care services were available, but at a cost not affordable to the poor. In 2011, an executive order created Linaw Tingin, a comprehensive eye care program for all Tarlaceños, the goal of which is to reduce the prevalence of avoidable blindness in Tarlac using these strategies. Disease control focused on the big 3 with cataract as a priority. An eye workforce was created using the health human resource already in the province through capacity building and innovation. Barangay health workers were trained to be primary eye care workers, capable of vision screening and case finding. Doctors and nurses in the rural and municipal health units were trained as mid-level eye care workers to manage simple eye cases. And to man the eye center, we turned to innovative engagement. All private ophthalmologists practicing in Tarlac were invited to become consultants at the TPH Eye Center. In essence, it was a public-private partnership where government provided the infrastructure, equipment, referral system, patients, and logistics, and the doctors brought in their expertise and technical know-how. They are not salaried, but they receive the professional fees paid by PhilHealth for surgeries they do. So far, we have trained 600 barangay health workers, and we're training more this year, 45 doctors and 48 nurses from the government health units. We've trained more than 2,000 deaf ed teachers, particularly in levels kinder, grades 1, 3, and 7. At the Eye Center, there have been 26,563 consultations as of December 2013. It's a 400% increase from our initial census of 2,586. 4,225 surgeries have been performed, 86% of which are cataract surgeries, and 95% of these patients use PhilHealth. We have screened 101,520 students. Eye care services are available, accessible, and affordable to the poor, specifically through PhilHealth. And our experience shows that indeed, the problem of blindness cannot be solved by one organization alone, but requires a constant cooperative effort among multi-sectoral partner agencies all the way down to the community level.
Now, as said by my cohort here, Dr. Shelley, Linaw Tingin program answers the need for affordable, accessible, and quality eye care services. There is no model for a well-developed district eye care program in the Philippines, and this program can definitely be replicated. Yung mga mahihirap ayaw talaga pumunta sa sentro, ayaw magpagamot kasi takot sila bubunot Pero for a mere 100 pesos, they're elated to know that ganun lang pala kasimple because PhilHealth insurance system provides for the financial viability of this program. And of course, utility and happiness among the BHWs that take care of them to bring them to the center. The community thing and institutionalizing the program is one of the best things that happened with us in terms of developing this project. Thank you.
I noticed your capital investment is about 167 million for your infrastructure, and I'd just like to find out where you sourced that and whether you're able to capture the investment already.
167 million was the whole building that we built. Second floor, third floor. Part of the first floor is where I placed the eye center. Nasa about 10 million siya. Say 10 million. We spent on equipments about 8 million. And we started off with this. So in about, ngayon, we're averaging 4 million in terms of net income, including depreciation costs and being able to get back the investment for improvements every 5 years on the facility.
The governance part, has not been highlighted in your program, which I think is your innovation, really putting together the convergence of doctors and serving as a bridge, di ba?
Sabi ko sa sarili ko, pwede na magawa ito sa ibang parts ng country. Yung ophthalmologists, kung payag sila, under our current operating, kung meron pang magandang operations like the private sector, very efficient, pwede sila mag-operate ng whole day. Yung mga incisions na ginagawa ngayon ng cataract, which is phaco machine, yun yung unang binili namin, reduce the cycle time from 40 minutes to 15 minutes yung operation. Maraming nakukuha yung mga doktor.
Anong nagtulak sa inyo? Bakit kayo pumasok dito? Wala namang probinsyang pumapasok dito.
At that time, nung tinayon nga namin yung building, we were waiting for the national government. Dumating si Secretary Ona, tayo kami ng building, bigay sila ng equipment. Medyo natagalan. Because of that, I was forced na magbukas na kagad ng isang bagay na gusto ko talagang gawan. Yung OPD, which is a building yun na ginagawa namin. Because of this, it led to a focus on programs na hindi kinakailangan nakahiga yung mga pasyente. Cancer, heart diseases, these things, and a lot of other things. So, why? Gusto namin i-test at i-model na kahit walang tulong sa gobyerno, on our own, kaya ba namin kung maganda yung finance? At that point, nung nakausap ko yung mga doktor, payag sila sa 7,000 na binibigay ng PhilHealth, kami naman, we can make do with the others because hindi naman sila, yung mga pasyente, hindi naman kailangan matulog doon. Alis na kagad kinabukasan. I think, yun ang feeling ko, click ito kagad, kayang bumawi. And it did, it showed.
Bakit mata?
Andun ako sa patay na kaibigan ko, ophthalmologist. Kinuwento niya sa akin, sabi ko, paano ba yung kung maganda yung offer ng PhilHealth sa cataract patients at 16,000. Sabi ko, magkano bang gastos dyan? Now, ang sabi niya, 50% ng matanda at 50 years old, at 60 years old, will require a cataract operation. 50%. After 5 years, tumataas yung statistic from 50% requirement to 60%. So if we have about 1 million people with 2 eyes at 2 million eyes, yung statistic nandun para magkaroon ng operations year in, year out. Definitely pwedeng ma-address yung number. Ang dami naming ginagawang mga medical missions, hindi naman nasasatisfy lahat. Doon, gumagastos pa kami. Dito sa eye care, kumikita kami. Bakit pa gagawin medical mission siya? Pwedeng araw-araw na medical mission. Our 4 operating rooms na backup can provide for 5,000 eye operations a year and can put an income, a very good income, at a cost of 100 pesos to a poor indigent. Because covered in the PhilHealth ngayon, 50% ng society.
Brought to you by PhilPost.